But here you have, and again, the show is about the truth of about money. Here you have the healthcare industry. Here you have health insurers. Here you have Harvard HMO or Tufts HMO. Here you have Blue Cross Blue Shield. Here you have all the health insurers out there, and all the big pharmacy companies. So those two lobbies together are behemoth. In 2006. Trying to strategize, trying to position themselves where they can be part of this bill, that they're not going to be cut out of it completely. So I'm guessing, Mr. Gay, that a compromise solution was reached with this industry, with the health insurance industry, the pharmaceutical industry, that somehow that they would be involved, maybe even administering this plan. And that's where it all fell apart. Is that correct?
Very prophetic guess, yes.
I haven't been back in Massachusetts in years.
Me too.
Incidentally, I used to live in Gloucester. I ran an AIDS shelter up there, and then I directed AIDS Project Worcester, which is drug treatment and AIDS, and then also Cape Cod AIDS Council. So I was pretty intimately involved with the healthcare system, particularly as it related to low-income people. But what I know about Massachusetts politics is that it's it tries to be very inclusive, and there's a lot of coalition building and a lot of consensus building. I always talk about that. So I'm guessing the consensus had to include the participation of big money health insurers and big money pharmaceutical companies. How did they worm their way into this program? What was their role?
Well, there's lots of things about Massachusetts that are a blessing and a curse. One is that we have a very large healthcare industry. The Boston area is renowned for its medical specialists, and in Massachusetts, the healthcare industry is 1 out of every 3 healthcare dollars in gross state products. So literally, the healthcare industry is more powerful than the traditional employers in the state. They are the most powerful industry lobby in the state. And to control healthcare costs, there's no way you can do that without tackling one of the many-headed hydras of the healthcare industry. You either have to tackle the health insurance industry, you have to tackle the big hospitals, or you have to go after the pharmaceutical companies. And they're very good at fighting back. So essentially, this was a bipartisan compromise around expanding access, but not a compromise around controlling costs. So basically, we're trying to, what's common in Massachusetts and all these other state reforms that we looked at is that everyone agrees about extending access to the uninsured. Everybody wants to do that for their own reasons, but nobody wants to pay for it, and nobody wants to take the hit for controlling costs. So we end up with these compromises that extend coverage to the uninsured or try to, but then when it comes to actually paying for it, there's no compromise on that. And the whole coalition that built the Massachusetts bill, when we're now looking at healthcare costs and the laws falling apart, that coalition doesn't stand when it comes to, they don't stick together when it comes to controlling costs.
All right. So what's the answer, and how do you? I hate to use this expression. How do you buy out the interests of the healthcare industry?
Well, I mean. The United States is really an outlier in the world. Certainly, almost all the developed world, but increasingly even the developing world is turning to a public health insurance model. And the reason is simple: we spend 2-3 times as much per person as any other country in the world, and we have among the worst health outcomes. We have a very low life expectancy. Lower than lots of developing countries in the developing world. We have extremely high infant mortality rates. And then just recovery from management of chronic illnesses, this sort of thing. We just have a very poor outcomes for all the money we're putting into our system.
Ben, has there been any studies to look at what the economic perspective is as far as the mortality rates and who's getting better health care? Because it seems to me like it's an economic picture based on the kind of widening spread of the haves and have-nots. Does it seem like in any of the studies that you've seen that the have-nots are actually getting worse and worse and the haves are getting better and better coverage?
Well, definitely. I mean, the percentage of uninsured is rising. The percentage of underinsured, people who have insurance that's not adequate, is rising. steadily every year. So, I mean, there's just a continued erosion, and mostly what we're seeing now actually is that uninsurance and underinsurance is spreading high into the middle class. The poor for a long time have had poor access to health care in the United States. Larger and larger chunks of the middle class are now having difficulty affording health care.
But have there been any studies? Have there been any studies based on the actual income status of people that are dying?
I'm not sure about mortality rates, about income status. I'm sure there's studies out there about that. But even just the census figures look at income in the uninsured, and race in the uninsured, and ethnicity in the uninsured.
Mm-hmm.
Okay, so you were talking about what your vision of what would work.
So I think we learn from the other countries who have achieved universal health care, better health outcomes for less money. And we need to, we need to make health care a right, basically. And the lucky thing about that is it's actually cheaper to provide health care as a right. And that means it's something like our public education system, but without all the messed up problems with our public education system, making it a right, publicly administered. People can buy out of the system if they want. If they want to. People can buy supplemental insurance if they want to. But we need to move towards this rights-based, affordable health care.
What country would have the best model, in your opinion?
Well, every country has their ups and downs. Canada's one we look often to because they're closest to